New details in a Team 10 investigation that exposed a loophole in a state law designed to stop doctors with a history of sexual misconduct from practicing. In July, investigative reporter Austin Grabish showed us how a doctor who had sex with a patient got to keep his license. And they weren't the only one. Tonight, he follows through with an update on the effort to close that loophole. We should warn you, some of the content may not be suitable for all viewers.
They need to act more quickly. They need to believe the patients.
Marion Hollingsworth is outraged. The patient safety advocate can't understand how Dr. Anthony Bianchi still has a medical license.
He was just put on probation. It's mind-boggling.
The gynecologist made headlines a decade ago after California's medical board found he committed sexual abuse and misconduct with 3 patients in Fallbrook.
So according to the medical board, this doctor pulled a razor out of his pocket and told his patient he wanted to shave her genital area. He then said, quote, "You have no idea what you do to me. I had to use a whole bottle of Vaseline."
It is so inappropriate. It really is, in my opinion, very creepy. He should not have done that. He should have just done whatever he was supposed to do as a doctor for her medical treatment and not try to dictate how she looks, not comment on how someone makes you feel.
The incident wasn't isolated. The medical board says Dr. Bianchi didn't wear gloves while performing a vaginal exam at a follow-up appointment. The doctor then exposed himself according to discipline records and said, "Look what you do to me," before asking the woman to have sex with him. Bianchi graduated medical school in Texas decades ago. In 2014, the Texas Medical Board revoked his license after California banned him from seeing female patients for 5 years. He remains unable to practice there today.
So what does that say about our medical board if another state's revoking a doctor's license, but the state here is still letting them work?
I think it's terrifying because, like, at what point do you put the patients before the doctor? I mean, if other states are revoking, you would expect California to do the same thing.
The California Medical Board let Dr. Bianchi keep his license after he finished probation in 2021. And he's now in good standing, free to see patients. But where he may be working isn't clear. 3 years ago, state lawmakers passed Assembly Bill 1636. The law was supposed to prevent physicians from getting their revoked or surrendered licenses back if they had been disciplined for sexual misconduct.
It sends a very clear message to providers here in San Diego. It sends a clear message to providers throughout California. But
Senator Akilah Weber-Pearson introduced the legislation and told us how she intended the law to work.
Once they try to come back up for renewal of their license, that will be flagged and they will not be able to get renewal of their medical license to continue to practice here in California.
But a Team 10 investigation in July found a loophole. It let a gynecologist who previously had his license revoked keep practicing. Dr. Austin Kuba had sex with a patient and wrote her a prescription for an abortion pill after she became pregnant. The medical board revoked his license in 2018 and called his relationship with his patient an egregious violation of the law. Our investigation found the regulator reinstated his license just weeks after AB 1636 took effect in 2023.
My jaw dropped when I saw it. I go, but it's supposed to take effect. It's supposed to be in, the law is supposed to protect patients from people like this.
The medical board says because AB 1636 wasn't law when Dr. Kuba's hearing happened, the legislation didn't apply to him. A spokesperson says the law was written in a very specific manner and only requires the board to revoke a license if the physician was convicted of certain criminal offenses. Quote, the board is only able to discipline a physician to the extent that the law allows, and when supported by clear and convincing evidence. Kuba's LinkedIn shows he's now working at a clinic in Calexico. Hollingsworth is calling on lawmakers to close the loophole. She says the law also lets doctors leave California to work in another state. That's what happened with Dr. Samer Kabani. In 2023, California's medical board accused him of sexual misconduct and gross negligence. An accusation says the physician stared at a woman's breasts and tried to kiss her on the lips. The woman was a caregiver for an elderly patient of Kabani's. Despite accusing the doctor of sexual misconduct, the board says AB 1636 doesn't put his license in immediate jeopardy because the matter involved unprofessional conduct, not criminal charges. The cardiologist is now listed in good standing with Florida's health department.
I think the new states need to do a better job in reviewing the doctor's history. They need to check to make sure the doctor hasn't been disciplined.
A medical board spokesperson says the agency does submit doctor discipline to the Federation of State Medical Boards. Quote, the various medical licensing boards throughout the nation can review the reports when considering whether to grant a license. But the spokesperson admitted the board does not track whether certain states automatically revoke a license if the doctor was disciplined for sexual misconduct in California. In another case uncovered by Team 10, the medical board allowed a Chula Vista doctor accused of touching 2 of his female colleagues' breasts to keep working. Dr. Carlos Carvello lost hospital privileges at Scripps in 2019. State records show he's currently on probation and must have a chaperone when seeing female patients. Hollingsworth says all of these examples are proof of just how lenient California's medical board is.
I think the medical board protects all doctors first. And even though the mission statement says their primary purpose is to protect California consumers, they always try to protect the doctors first.
The medical board says it's simply following the law and would enforce tougher rules if lawmakers pass them. None of the doctors mentioned in this story returned our requests for comment. Austin Grabish, Team 10.
Austin is a government watchdog. He also covers the California Medical Board, military investigations, and the border. Send him your stories by scanning the QR code on your screen or emailing him at austin.grabish@10news.com.